Hi, it's Gary Chimes from Lake Washington Sports and Spine, and what I want to go through today are the 3Ds, which is the way that I like to think through a medical problem. So a lot of times somebody comes in to see me for like their shoulder hurts or their knee hurts or their back hurts, and what they really want to do is get to feeling better. And if I could just jumpstart that process, you come in, you tell me your story, and I can make you feel better, that would be great. But generally that's not going to be an effective approach. And what I really need to do are go through what I call the 3Ds, and those are going to be data, diagnosis, and decision. So I want to break this down a little bit. In order for me to help somebody, I need to know what the problem is, and the person might be living with that story, what's been going on, but this is my first time experiencing for them what's going on. So if their knee hurts, I need to know that. And then from that data, which I'll go into a little bit more detail, I want to come up with a diagnosis. What do I think is the cause of the symptoms? And then from there, make a decision about how to treat that diagnosis. And as much as we want to kind of speed through this process, a lot of errors get made by focusing on pattern recognition, hearing the first thing that comes to their mind, making a quick judgment about the diagnosis, and just jumping to a treatment. And that can get sloppy and things can get missed. So what's involved with data? So data is going to be really a history, me interviewing the patient to find out what things are going on. And I really am going to focus primarily on timing, location, and movements. Those are going to be, so if you hurt your knee, when did you hurt your knee? If you hurt knee, where did you hurt? Can you point to the area that you're feeling the symptoms? And then what movements tend to provoke the pain? From there, I'm going to do a physical examination. That's going to be really important for me to be testing the motion of the area that's injured, look at the areas above and below. And then we might be looking at some other data, things like imaging tests or lab work, or consults from other physicians. And it's really as important as possible as I'm collecting that data, for me not to be making any assumptions about the diagnosis or decision. I don't want to bias my data collection process by making assumptions. Once I have that data, what I want to then think of are what are all the possible diagnoses. So if somebody comes in with anterior knee pain, I want to think about what are the top 10,000 causes. And I actually like to think like I'm making a Venn diagram. So this is just showing 3, but it might be more diagnoses. So let's say I have anterior knee pain. I might think about patellofemoral syndrome, medial compartment knee arthritis, and quadriceps tendinosis. And what I want to know about is not just the stuff that's common to each of these different symptoms, but what are the things that are unique and distinct. That way I can really clarify what diagnosis I'm dealing with for sure. So let's say I go through that process and I become convinced that the person has quadriceps tendinosis. At that point, I'm really ready to make a decision about how we treat it. There's a couple reasons that I think it's useful to kind of lay this out, because sometimes people come with a thought about a treatment before they have a clarity about what the diagnosis is. Somebody might come to me with knee pain and say, hey, I've heard about stem cell, what do you think about stem cell? And to answer that, I really need to know, well, what am I trying to treat? In order to know what I'm trying to treat, I need to get data to get clarity on the diagnosis. So the reason I bring that up is I'd like to have a nice 45-minute visit where you can kind of systematically go through this process, and at the end of that comes the decision about how to manage things. But it's important that I go through that process in order to help you. So this is Gary Chimes at Lake Washington Sports and Spine.